Good evening to all the viewers who are watching live and will be watching on a recorded version. Uh, it is hereby to say that we are on our 74th online CME, which is a milestone to achieve. We have achieved till now. So we have wasted 10 minutes and let's not waste any more time. Let's just begin with our 30 seconds countdown time. Then we will proceed with our 74th online CME.
Good evening, all our respected viewers across the globe. National Institute of Homeopathy Alumni Association started this endeavor to connect all the alumni across the globe by virtue of continued medical education program. We started long back in 2020, and today we are proud to say that we are on the 74th episode of our CME. And tonight, we are going to present all our viewers to excellent speakers whom you had been waiting for long to go ahead with the details of tonight's eternity. I'll request on our live screen today's inaugurator, Dr. Ramkrishna Ghosh, who is the head of the Department of Surgery, National Institute of Homeopathy. Dr. Ramkrishna has been an stalwart alumnus of NIH who had done his MD not only once from NIH but twice. Let's welcome our beloved Dr. Ramkrishna Ghosh on screen to inaugurate tonight's session.
Thank you, Bidyut. Good evening to all respected alumni who are watching this program today across the globe. It is a great privilege to be a part of this program, CME program, which has been running for last 3 years, 2020. Since 2020, it has been going on, and it is really a prestigious, it's a matter of pride to be a part of this program today. On behalf of this alumni group, I would like to request my all respected and beloved alumni who are watching to observe this program very seriously, because one of the important topic is there today will be presented by two most eminent alumni, especially Dr. D.N. Kalyani sir, who is the president of this alumni association also, and Dr. Pralay Sharma, who is now is a very known figure to this group, is also acting as in charge of the hospital National Institute of Homeopathy. And you all know that now this is not only a national institute. Since 2008, it has already been into an international institute, because across the globe, so many students are coming to learn homeopathy here, and they are already engaged. The students who passed from NIH has already engaged globally. So we can now call this institute as an international institute and a very premier institute. You know, all of us are very feel proud that we are the alumni of this institute. Now, let us start with this program today. I feel really proud to be an inaugurator of this session. Today's topic is 300 cases of mainly the degenerative diseases of joint disorders. Basically, most of them are osteoarthritis, and that cases are from NIH OPD only, and has been treated, and almost maximum cases has been cured by Dr. Kalyani sir. And Dr. Pralay Sharma also, he has been treating us since long. Since 1997, he has been working here in this institute as a medical officer, and now he has been working as he is now in charge of this total hospital. He is looking after this hospital. So I would like to request our eminent speaker now today. The moderator is Dr. Goutam. Basically, Professor Ash is uh, he was the director in charge of this institute, but somehow I think I came to know that he will not be able to join this program to moderate due to some issue. So I would like to request our speaker to start this program. Uh, Dr. Kalyani sir, please start this program because Dr. Ras will not be available today. Sir, am I audible? I don't know am I audible or not because some technical issues are going
You are
on
all
constantly.
you are audible, but in my computer there is some problem. Errors are coming. I need some help. So can I come later on
So it will be better
after the
if Dr. Polada, if you, uh, it will be better Polada,
because
you start with this program first because Dr. Kalyani sir is having some problem with his computer.
facing some problem.
So
I have to
Polada,
Okay.
call
if
my
you are
brother.
ready, you start.
Yeah.
Better you start first.
Yeah.
So it will be
Uh,
better
with
Polada first.
due,
Dr. Polar Sharma will start program.
sure. Good evening. Uh, with due permission from our President, Dr. D.N. Kalyani, and our Secretary, Dr. Bidyut Mukherjee, I would like to present one presentation. In this platform, I would like to convey my gratitude to all the viewers who are watching this CME program right now online. And I'd like to pay my all respect towards the viewer who near future will be watching this CME program in YouTube. I'd like to pay my regards to our today's moderator, Dr. Ramkrishna Ghosh. And to begin with today's topic, what we like to share is that I don't have any PowerPoint presentation. Reasons are many. There are advantages, there are disadvantages in PowerPoint presentation. Whatever I will like to talk, I will talk in a sense of whatever we do in our daily practice at National Institute of Homoeopathy. Today's topic is a very interesting one. I will take only half an hour time, and within this time, I will try to focus on how we tackle acute exacerbation in chronic illness. And to begin my talk in this subject, I would like to say that to do so, to tackle this acute exacerbation, one should make the disease diagnosis first. One should be aware about the nature of the disease. Having done the diagnosis, one has to know the complication of the diseases. I have to predict that what are the complication can knock at your door within 1 hour, within 1 day, within 15 days, within 1 month, or after a couple of months. Unless we know the disease diagnosis, we may not understand the complication. And while beginning the treatment, while after making the disease diagnosis, we have to understand the complication and the chances of the symptoms we have to be aware of. Unless we do know the disease diagnosis, directly jumping to the symptom may not relieve the symptom. There are ceaseless number of examples that whenever you know the disease diagnosis, you can treat the acute exacerbation. Our treatment of acute exacerbation basically comes under the heading of the palliative treatment. I would like to share some of the cases which are the chronic in nature. The illness is chronic in nature. That is the carcinoma, that is the cancer. Nowadays in our OPD, we do get number of cancer cases. You like it or not, you want to take the case or not, whether you like to treat the case or not, one has to be with the cancer patient. Referring a case, basically what I understand, you are avoiding your responsibility. And to treat the cases, you need to have a complete knowledge about the cancer cases and the complication too. Unless we understand the complication, you cannot begin with the treatment of the cancer cases. A cancer patient will have a terminal illness, in fact. Once you understand it is a cancer cases, unwanted or perverted growth somewhere, you can make a plan for the palliative treatment. And after long run, if the patient goes on well, if the patient improves, then only you can come to the constitutional treatment. But in this journey, in the short journey, while you get a cancer patient, from the first day, you can plan for the palliative treatment. And palliative treatment is not that if somebody is vomiting, you give a relief to the patient. If somebody is a pleural pain, you give relief to the patient by giving relief of the pain. It's not. If somebody is bleeding per rectum, somehow you manage the bleeding per rectum. In one sense, it is not a palliative treatment. Palliative treatment, again, a holistic treatment. So in case of cancer cases, in case of chronic illness, what we try to understand is to plan for the palliative treatment. One has to go certain symptomology. One has to go with the certain process. The process is that one has to understand that why this cancer has occurred to this person. His mental disposition, his mental state, his mental symptoms has to be taken. As we all know that repeated mental trauma has to be taken into account. Mental disharmony has to be taken into account. Sudden outburst of the emotion has to be taken into the consideration. If somebody has a suppressed grief, has to be taken into consideration. If somebody has developed a conflict, a domestic conflict, then again one has to take into consideration. And we do have a multi-dimensional medicine. Not only that grief, ignatia, natramur, cyclamen, causticum, etc. Anger, staphysagra, etc. We do have number of the medicine which has to be taken into consideration, and the complete picture has to be there. This is number one, mental sphere we do take in case of palliative treatment. Next on priority, it comes is the suppressed diseases or the recurrence of the diseases in past. Suppressed diseases, we all know, the skin disease suppression. Recurrence means there is there can be repeated, there will be recurrent history of the jaundice. There can be recurrent history of suppressing this tinea corporis. Suppression of the disease is an important one. And to some extent, the history of vaccination is again contributes in understanding the disease process as well as in selecting a remedy. In the process of choosing a palliative medicine, we have to also take into consideration the symptom with its all modalities, aggravation, amelioration, concomitants, etc., etc. The Boning-Bogar-Hassan method. If we can comprehend mental suppression and symptoms, present complaints, present symptom with modalities, then we can choose a very special palliative medicine for the patient in particular. So we will prescribe that palliative medicine. Patient is on palliative medicine. If by God God blessing, some days patient has improved a lot, patient doesn't have the symptomology, then we can turn over to the constitutional treatment. In this regard, I would like to quote one book, and the book is written by Dr. S.P. Dey. Only 6 pages article will change your mind towards the palliative treatment. He very clearly says, whenever in cancer cases you have to operate, you do operate. When operation is not possible, when there is extended metastasis, when there is a contraindication for operation, then one has to go for the palliative treatment. If chance is given sometime, somewhere in near future, one can come back to the constitutional treatment. So idea has to be very clear. In chronic illness, if you like to give a palliative treatment, you give it. You give it by higher potency. You give it by lower potency. You give it by the very lower potency, whatever you can. Give relief to the patient. At the same time, one has to be aware about the complication of certain cancerous diseases. And the cancer is a journey, in fact, that has a start, doesn't have an end. In cancer patient, we have to give a holistic approach while doing the palliative treatment. In fact, palliative treatment speaks about holistic action towards the patient. If somebody have a frothing in mouth, you have to clear the frothing. If somebody have a ascites, you have to tap the ascitic fluid. If somebody has pleural effusion, you have to take away the pleural fluid. If somebody doesn't pass the stool regularly, you have to give enema. Along with that, one has to give the palliative treatment. If the saturation levels is down, you have to go with oxygen therapy. One has to be there in holistic action towards the patient. Now the question is that the topic of discussion is an acute exacerbation. What is that? Acute exacerbation means our cancer patient was doing well. He was doing fine with this. Suddenly, some symptomology the patient presented. What is that? A patient of malignancy, or a patient of cancer, having gone through the metastasis, developed a severe back pain. A severe back pain, and the pain is radiating downwards. We understand this could be because of metastasis of that particular cancer to the bone. And that is giving a compression in the lumbosacral region. compression in the form of radiculopathy, myelopathy. The compression is there. In our day-to-day practice, what we have seen in the cancer patient, if there is an acute exacerbation of the pain, especially in the low back pain, severe pain, in case of compressive radiculopathy or myelopathy, we may require a plumbum metallicum. Plumbum metallicum is such a medicine which covers the lumbosacral radiculopathy as well as the myelopathy too. It is a compressive. No long nerve, where there is a long nerve distribution, long durated, long length of pain. We always think of plumbum met if it is a compressive. Whereas if it is short nerve, like in optic nerve, we always think of carbonium sulfate. We do have experiences into it. And to talk about this plumbum metallicum, what I would like to say, that because of the cancer, the patient has become emaciated. Patient has become anemic too. And the patient have a very greasy skin over the face. You know, we all know that netramure has a sweat over this face. What I believe, the plumbum metallicum have more of the sweat, more of the greasiness than the netramure. The greasiness are oily, extreme of the oiliness in the face, whereas other part of the body is dry, indicates plumbum metallicum. Extreme chilly patient, plumbum metallicum. Chilly patient may not be extreme. A chilly patient may require this plumbum metallicum to some extent in case of acute exacerbation of chronic illness, cancer to lumbosacral pain. And as you all know, the plumbar have a peculiar symptomology. The symptomology is absolutely like that of a ruta. Symptomology absolutely like that of your terminalia tubulum. The symptomology is that pain released by heart pressure, pain released by rubbing. Again, it's a symptomology of plumbum metallicum. So my dear friends, what I like to add is that in case of cancer cases, if you get low back pain and there is a severe pain in the back, which is radiating, then one must think of this plumbum metallicum. The patient has to be emaciated. There has to be muscular dystrophy, wasting of the muscle. So this is what regarding the plumbum metallicum in case of cancer who has developed acute exacerbation in the form of the low back pain, which has a specific radiation. And this radiating pain, have a special character of amyloidation, that is by rubbing and by heart pressure. If I am allowed to pass on to next remedy, in case of continued treatment of cancer, if somebody develops severe constipation, and along with severe constipation, patient have again a low back pain, and the patient gets up from the bed by using this both of the hands. A emaciated patient, extreme of hunger, will always invite hydrastis. This hydrastis is a medicine which have hydrastis is a medicine which is a constipation, which has a emaciation, which has a extreme of the hunger, And the patient earlier had patient in the process of continuation, the treatment of the cancer, and the patient develops low back pain or the constipation. We have a choice of drug. We choose this drug, the hydrostress. If I am allowed to speak on another subject, another medicine, that is aluminum. A person who has esophageal carcinoma, who has esophageal carcinoma, and patient cannot eat for long time. There is a muscle wasting. There is a wasting in a sense that the muscle has been atrophied. एक minute. Everything in the body has become slow. The bowel movement is slow. Urine outflow is slow. Sweating is slow. Everything is slow. In case of cerebrovascular accident, in this process of slowness, we think of one medicine, that is a pituitary 30. Everywhere slowness. But in case of cancer, particularly cancer of the esophagus, if there is a slowness, we think of this alumina to prescribe. And alumina, you all know, the alumina is a chili patient. Alumina have an aversion to the meat. And this alumina, out of this chronic illness in the form of cancer, if the patient have some impact over this, over the renal system, and patient requiring repeated hemodialysis, again, whether hemodialysis or not, doesn't matter. But once cancer plus hemodialysis, if some symptom corresponds like chilliness, like constipation, slowness, the drug of choice of any of the acute manifestation of the patient can be bleeding from per mouth, can be bleeding per rectum, there can be a complete changes in the blood picture, there can be respiratory tract infection, whatever they have, the alumina will give a relief to the patient who have been suffering from the CA esophagus and requiring the repeated hemodialysis. This is what the three drugs what I have talked about, and the upcoming drugs too. All drug have emaciation, all drug have anemia to some extent. And in the meantime, let me tell you that if somebody is bedridden for long periods, if somebody is non-ambulatory, if somebody is bedridden, patient spontaneously, automatically develops polymyopathies and polyneuropathies. We say myopathies and polyneuropathies. Unless you give up active physiotherapy, you cannot prevent this polyneuropathy and myopathies. So this is a chronic illness patient. We will always encourage them to be active in the house. Otherwise, a bedridden patient will always invite polyneuropathies and myopathies. The drug what we have described, in the light of emaciation, in the light of anemia, the terminology, the polyneuropathy and myopathies is hidden there, is slowly flowing. in each and every patient. Next, I will talk about one drug. This drug had been used by many of the very eminent physicians of Kolkata in case of breast cancer. In case of breast cancer, when there is a pain in the left side of the chest wall, and this pain is radiating towards the axilla, this patient is emaciated. Advanced case of CA breast, emaciated patient. The medicine is a bromium. Bromium is a medicine which can be given in early phase of breast cancer. But once there is a metastasis, of CA breast to the lung, if there is a pain in the left side of the chest and the left, a phone came. I believe that I am audible. And the patient is emaciated. Patient is emaciated, and the bromium can be given in case of chest pain who is continuing with the treatment of a CA breast. The issue is that many a case in our daily practice, a cancer case does have several comorbidities. Somebody have diabetes, and that person is taking oral hypoglycemic drug or insulin. Somebody have a dyslipidemia, patient is taking medicine for dyslipidemia. And somebody is hypertensive, patient is taking medicine for hypertension. I'm talking about modern medicine. If somebody have hypothyroid, taking medicine for hypothyroid, we do not discourage. In one day, to avoid this modern medicine, to withdraw the modern medicine is an art. Unless in the pathological report, unless in the blood pressure by measurement, unless you have reduced the dyslipidemia, unless you have reduced the blood sugar level, gradually one has to taper the dose, and one has to bring the patient towards the palliative treatment or towards the constitutional treatment. Very, very difficult job. Agree with me or not? Very difficult job nowadays. The option is given to the patient. For your comorbidities, you keep on taking your modern medicine. A long continued medicine should not be hampered. Your treatment will be hampered if you withdraw all the medicine. The body has taken all the drugs in its account. The body is happily has taken all this medicine. We should not disturb it. But if you at all have to have a mind to withdraw this medicine, one is to withdraw it gradually by clinical assessment as well as pathological assessment. I will talk about one drug, is uranium nitricum. As you all know, in early phase of diabetic nephropathy, we give uranium nitricum. But my friend, this uranium nitricum is equally important in the process of treatment of a cancer, wherever it can be. If out of this cancer, the patient has developed dropsical condition, maybe pleural effusion, maybe ascites, maybe bilateral pedal edema, maybe puffiness of the face. If the patient has developed dropsical condition, If the patient is of, especially of CS stomach, if the patient has a rapid emaciation and the patient have excessive tendency to vomiting. So in case of CS stomach, if somebody vomits, we do have a number of medicine. This can be cobaltum, it can be cadmium salt, it can be ipecac, it can be bismuth, it can be phosphorus and whatnot. But my friend, do not forget about uranium nitricum in case of cancer who has a dropsical condition as well as has a tendency to vomit. It can cause a wonder to the patient, provided the patient has a emaciation. The emaciated patient with some degree of anemia, with a dropsical condition, in a case of CA stomach, if the patient vomits, we tackle this acute exacerbation, rather the complication of CA stomach in the form of the vomiting of the patient. By giving this uranium nitricum, one can prevent the ascites as well as one can prevent the occurrence of the vomiting. It can be beautifully tackled. Next drug is a very interesting drug. Next drug, what I would like to talk about is basically drug for the cardiac patient. If someone who is emaciated, who has aurum metallicum like mind, yes, I'm talking about aurum iodum, aurum iod. Mentally, the patient is
Maybe due to some technical difficulties, is having trouble with network. We will be getting back soon. Please hold on until then.
I believe that there was an interruption in the internet. Uh, if someone can open the audio mode and say to me that I am audible.
Open. Sir, over to you, sir.
Okay. I'll take 10 minutes more, hopefully. And what I have been talking about the aurum iod is a mentally of aurum metallicum and physically the patient is of iodum, increased appetite and the emaciation. A cancer patient of cancer anywhere in the body who has suddenly developed the cardiac complaint. The patient already have as a comorbidity, patient have hypertension and dyslipidemia. A cancer patient with hypertension, with dyslipidemia has started some complication, breathlessness and palpitation. We understand Clinically, one can understand by examining the heart rate, by examining the pulse rate. If there is a pulse deficit more than 10, we understand this could be atrial fibrillation. Atrial fibrillation means is this arrhythmia. Arrhythmia cases may be cancer or may not be a cancer. Is well tackled by two of the medicine. One is digitalis, and best possible medicine is aurum iodum. The patient have extreme of thirst. Extreme thirst patient do have arrhythmia plus. Extreme of appetite, increased appetite, has lost the body weight, has developed a cardiac arrhythmia, is a aurum iod. Such a beautiful drug, this aurum iod is, but it needs a continuous, constant observation of the patient. Once the arrhythmia is recovered, we have to stop within 1 day, 2 days, 3 days of time. We have to stop this aurum iod. The last medicine, hopefully, I will talk about is your acetic acid. You all know that acetic acid try to lie on abdomen like that of your carcinosin. Always better by lying on abdomen. This acetic acid also have emaciation and dropsical condition. And more of gastric origin carcinoma are covered by the acetic acid. And the keynote of acetic acid, once again, is a vomiting, dropsy, and emaciation. Dropsy especially of ascites. And patient tries to lie down over the abdomen. And the patient have a profound, a severe, moderate to severe anemia. To stop the suffering, to stop the acute illness, like vomiting, if the other symptom corresponds, we are always ready to give the acetic acid. These were the medicine. This medicine have emaciation. This medicine have anemia to some degree, mild, moderate to severe degree of anemia. And this patient is almost non-ambulatory. This medicine have in background polyneuropathy and myopathies because of prolonged illness. This medicine does cover some of the acute exacerbation of the chronic illness. I believe that I have taken around 40 minutes of time, 35 minutes of time. And this session, whatever I have talked about, is a clinical experience at our National Institute of Homeopathy. I should be very thankful to the viewer today. I should be very thankful to my teachers who have taught me in my BHMS course and later on too. I'm also thankful to the patients who are attending the National Institute of Homeopathy in large number. Dr. Kalyani used to say, the patient are the best teachers. I agree. Patient as the best teacher, and while treating a patient, the gathering of the students, gathering of the BHMS student, gathering of the postgraduate trainees, possibly the best teacher for us. Because whenever we say one drug, two drugs, forgetting the other drugs, from some corner they will make some sound, adding some very relevant drug into account. continuously we are learning, and we'll keep learning in future too. With this belief, with all respect to the viewer, with all respect to my teachers, with all respect to the patient who are attending, I will conclude here. Thank you so much. Thank you for your patient hearing. Thank you so much.
Thank you, Polada. Thank you, Dr. Sharma, for your valuable lecture today. Now, I would like to request Dr. D.N. Kalyani sir to give his lecture on this topic. Sir, are you in studio, sir?
Yeah.
Okay, sir. Sir, please continue.
Thank you.
Dr. Sharma has finished his lecture. Now you just. Okay, sir, please.
Thank you, Professor Ramkrishna Ghosh. Many thanks to today's one of the brilliant speaker, Dr. Pralay, Bidyut, and all the others who are reading and they will be being later on. Definitely your presence, your participation is obviously encouraging us to continue this CME. Today we will talk about the last phase of degenerative joint disease. Since the first phase we are observing that so-called instructions of the medical science that degenerative joint disease is a wearing and tearing pathology of the joints, which is neither controllable nor curable. But NIH-OPD and IPD is presenting with documents that homeopathy not only it can prevent, it can cure degenerative joint disease radiologically. Many documents we have seen from very beginning, plus clinical observations was also presented. And the first phase we are talking about the basic ideas of the degenerative joint disease with clinical observations, clinical for 189 cases. Then the second phase was on the disc degeneration, intervertebral disc. Degenerative intervertebral disc can be regenerated. We have documentally presented. Third phase was on osteophytes, a serious disease of the bone where bone growth starts, leading to different types of irritations, compressions, and other pathology leading to severe type of pain. Then we have observed this subluxation can be cured by homeopathic medicines. Then you observe that the sclerosis, one of the dangerous diseases of the bone, can also be cured by homeopathic medicines. We documented that presented. Then we have in the fifth phase of this CME on this degenerative joint disease, we have observed that spondylosis with various types of pathological changes of bone can be completely cured radiologically. Maybe a little bit more time, maybe shortest time, all were presented. Today we will see few more cases of degenerative joint disease who are radiologically cured. Their name, registration number, drug given, period taken, everything has been given in a chart form. This was an article. It was made for publication. It was presented, but yet to be published. That I want to show you. Special attention will be on the radiological cure of the pathologies. This was an abstract. This article is a fragment of documented research output of regeneration of 29 degenerative joint diseases by homeopathic treatment. This is a follow-up radiological study by the author as chief investigator of the previous clinical research project on degenerative joint disease on 189 OPD and IPD cases published in Bulletin, NIH Bulletin, volume number 7, Volume 7, number 1, January 2004 of National Institute of Homeopathy, Salt Lake, Kolkata, under Minister of Oil, Government of India. Both clinical and radiological study was done in Department of Research along with advice, consultation, and assistance of other allied departments of NIH as per requirement. This article will present 29 cases of radiological cure of different types of degenerative joint disease. This article will present 29 cases of radiological cure of different types of degenerative joint disease with about 175 documentary evidences. It is a very huge in number, 179 documents, 75 documents. But we'll try as fast as possible. Just you see, you will get it in YouTube. As per your convenience, you can slowly follow the evidences. Keywords was, it is a format of publication. Keywords was homeopathy, research, radiological cure of degenerative joint disease, X-ray documentation, cheapest treatment. Introduction. Research Department of National Institute of Homeopathy conducted one clinical trial on effect of homeopathic medicines on degenerative joint disease. Appreciable output of the project encouraged the author for radiological follow-up study of degenerative joint disease. Old study taught that small, irregular, complex, weight-bearing joint disease produces signs and symptoms quicker, earlier, and in slightest bony pathological changes than big joints. Naturally, degenerative joint disease follow-up of big joints is very much time-consuming. To get the efficacy of homeopathy medicine to become confirmed, we attempted the small joints only. Study also teaches that weight-bearing spinal joints is very sensitive area to produce and reduce degenerative joint disease because encircling with spinal cord, finer nerves, nerve passes between the joints. So sensitivity of the spinal joints are much more than other joints. Hence, along with other joints, spinal joints, especially cervical and lumbar joints, were considered more as target for radiological follow-up study of the old clinical study. Enough information regarding protocol, aims and objects, inclusive and exclusive criteria, review of literature's work done report was given in the state previous publication. In this article, author like to draw attention of readers of this profession. Means this detailed information regarding the essentiality of research and publications were given in the last publication, that is, we have shown it, osteophytic regenerations. The specific radiological cure of degenerative joint disease by homeopathic constitutional individualization treatment. Total 175 documentary evidences are presented for 29 cases of degenerative joint disease. To curtail the volume, about 55 documents of cure of 9 cases of osteophytes have been presented in previous bulletin of National Institute of Homeopathy. About 120 documentary evidences are presented in this article that we have seen in the third session of the CME. This article for 20 cases of degenerative joint disease along with 9 cases of serpent articular facet, 3 cases of osteitis, 3 cases of degenerative joint disease, 4 cases of osteophytes, and 1 case of lithiasis are presented here. Readers are requested to concentrate only on the degenerative joint disease changes because many other findings, inclusive complete cure of all bony changes, may be observed in X-ray and its reports of the presented cases. Aims and objects. Aims and objects of the project was to study and observe the effect of homeopathic medicines on degenerative joint disease, whether this system of medicine can provide short or long-term relief of signs and symptoms of patient. Study was to observe the efficacy of this system of medicine in the traumatic, metabolic, iatrogenic hazards. To study the efficacy of homeopathy in various stages, degree, type of DJD, to study the improvement of quality of life of patient, to study whether better living by improved ability is possible or not, to observe whether homeopathy can reduce or stop modern drugs allopathic dependency, to avoid operative surgery by improving ability, to reduce signs and symptoms and radiological changes, to arrest progress of pathology, and symptomatology, to observe whether patient can develop improved calcium metabolism without supplementary calcium therapy. Here I want to tell you to all the alumni and others who are viewing that NIH Outdoor has observed that without supplementation of calcium from outside, without giving vitamin D from outside, patient can be not only better by symptomatically, but radiologically patient can be cured. That means the metabolic system simultaneously goes to that an extent that from normal foods, normal such rather normal condition, normal habitats, patient produces vitamin D, calcium, and it performs their normal activity to keep the bones normal. To study whether progress of degenerative joint disease to other healthy joints can be prevented or not. That is an important point. What we have seen usually that DJD is a progressive disease. As we all know, it goes from one joint to other joint, not by being infected, not by metabolism, but the basic reason for the degenerative joint disease, so long it remains constant, it gradually goes on attacking from one joint to other. We have seen many patients who started first from the cervical or lumbar pain, then knees, then here and there, gradually progress of the disease is common. Whether homeopathy can prevent this progression of the disease, it was also a point of aims and objects. To study the established evaluatory approach of homeopathic therapeutics or orthopedic disorders, to study and prepare a dictionary dietary of remedies with their potencies found more suitable on patient of degenerative joint disease. In this point, we had an idea, and you might have been knowing that nowadays many researches are on that target that find out few drugs or one drug, which is more common to cure a particular disease. I'm sorry to say this is not the fundamental principle of homeopathy. Still, to combat with the modern system of researches, homeopathy is trying to continue this type of research to specify few drugs which will be easy for the public to use to cure a disease. But in our study in NIH-OPD, we have observed that this is completely incorrect idea. I had a trial, I told you before that about 200 cases I given simply on symptomatic basis by Rastos, Bryony and Hypericum. Most of the patient got symptomatic relief, but not even a single case I found that radiological changes or radiological cure. Anyway, so from the very beginning, being convinced by this system of medicine, conventional system of medicine means, our traditional procedure, find out a particular drug for a particular patient, university prescription. We study and prepare a dictionary of remedies with their potencies found more suitable on the patients of degenerative. In the documents today, in the chart, we'll find that this point has become completely non-avoid. We'll see different drugs are coming in different cases. To study the clinical parameter in terms of age, gender, economic status, nutritional status, to reduce clinical and radiological findings of DJD, to study the basal metabolic index, BMI, parameters of the patient with DJD, to study To study the basal metabolic index parameters of the patient with DJD, to study whether this treatment is the most cost-effective, safe, soft, simple, minute scientific treatment of the world than other available therapeutic systems of the present world of the nanotechnology. You must all agree that till today, homeopathy can claim that it is most cost effective, means most cheap, safe, soft, simple, minute scientific treatment. Nowadays, world is dancing with nanotechnology. Hahnemann, few hundred years before, founded this nanotechnological system of medicine. Lastly and finally, whether homeopathic treatment can regenerate the degenerative joint pathology or not, which is claimed to be not recoverable disease. Methodology is very simple. As per inclusive and exclusive criteria of the protocol, you might be knowing that we cannot conclude all the patients. There are some patients we have to exclude from the project. As per inclusive and exclusive criteria of the protocol, patients both old and new of OPD and IPD of NIH are made registered depending on the clinical and radiological finding. Not even a single case was entertained without any X-ray reports or simply by the signs and symptoms. Detailed case history was taken in an approved case-taking proforma for diagnosis, management, and individualization. When the case-taking proforma and the protocol was properly approved by the competent authority. Debatable and specially selected cases were consulted with departments of surgery, orthopedics. We had at that time, I do not know patient status, we had our orthopedic surgery in our surgical department, and medicine as and when required. And you'll be astonished to know that majority of the assistance was from the allopathic doctor from the orthopedic department, including protocol, approved of the protocol, assisting in every point. We were maximally helped, especially my project was maximally assisted by one orthopedic surgeon and our beloved radiologist. After evaluation and repertorization, case was critically evaluated and repertorized. Drug is selected for each patient separately on the basis of individualization. Cases are followed up from 15 days to 1 month interval till clinical improvement settles, and as per seriousness of the clinical and radiological conditions, to establish unconditional effect of homeopathic medicines on uncontrollable unconditional patients. I like to clarify, homeopathic medicines are completely unconditional. That means diet, atmosphere, age, economic status, intellectual status, nothing is constant for treatment, nothing is barrier for our treatment, nothing is conditional for our treatment. So unconditional patients on additional managements was taken in general. Patients were advised to maintain normal mobility, normal diet, daily diet, normal activity without overstrain and stress on joints. This is to be noted that in our OPD patients, the patients were advised to maintain normal mobility, normal daily activities, normal activities without overstrain. Simply, they were advised not to take the activities by which your complaints aggravates or you feel stress or painful. Those things should be avoided. The rest of the activities you go on continuing. Strain and stress of the joints. Except some serious cases, it is obvious that depends on the seriousness of the patient, whether there is subluxation, listhesis, vertebral column has slipped out, compression, serious compression, giving to severe complaints. There naturally necessary management was advised. Otherwise, majority of the patients were asked to maintain normal life. And I told you before that majority of the patients are not even advised for physical exercises. That was my trial that I wanted to see whether only medicine can cure homeopathic medicine can cure degenerative joint disease, or physical medicine is essential. Diet is essential. That was my target. I observed that these are definitely effective, helpful, no doubt. But simply by homeopathy medicine, maintaining normal life, normal diet, without any addition of changes, patient can be radiologically cured. Symptomatology definitely it can be cured. Radiologically also it can be cured. We have documents. Clinical improvements took place much earlier, it is known to all of you, within 1 or 2 months. Radiological improvements were found much later, sometime long after recovery of the clinical signs and symptoms. There is one constant for all of us. We must agree, and I told you before that we are unfortunate that we did not have the sufficient necessary infrastructure in our institute. That's why we were not able to bring that patient back after their clinical improvement. When signs and symptoms are off, patient don't come to our OPD because attending an OPD is that of one complete day, full day, and our OPD patients are financially not that much sound. So naturally, when they get off their clinical and signs and symptoms, they feel they are better, they have been cured, no necessity to go for OPD to take the strain for the whole day. Naturally, we could not collect all the documented evidences before, during, and after treatment radiologically from majority of the cases. But there are patients who are cautious, sincere. They helped us a lot. They did X-ray after a period of complete recovery from the signs and symptoms and complete mobility, and they showed us the X-ray report. They have submitted the report for our presentations and records. It's a good luck for all of us. All necessary measures for proper and developed research work could not be followed due to lack of research infrastructure in NIH and poor economic condition of our patient and IPD patient. That I will tell you. But one thing I want to tell you that as a homeopathic system of medicine is unconditional. This finding and collecting, jotting down of pure documents are completely unconditional. It is said to be that research cannot be performed without fund, without a department, without proper protocol, etc., etc., etc. Definitely is needed, of course, because unless you are in an institution or active approved organization, you cannot continue this. Who will provide the fund? But the minimum thing you can do for a long period, whatever cases we are seeing in our chamber, clinic, or hospital, or OPD, wherever, health centers, we can definitely keep records of our recoveries, cures. If we go on developing this practice of keeping documentation, within a very short period, like me, you will find that hundreds are getting cured by homeopathy medicine. You'll be surprised to know that your ability, that you are able to cure so many diseases documentarily, certified by other expert persons. So please develop the habit of keeping documents, whatever cases you are seeing, not only for your benefit, but also for benefit of us and the whole profession. Evaluation, general evaluation assessment was done every 6 months and annually, and was submitted to Director of National Institute of Homeopathy through proper channel. These assessments were published in NIH bulletins as news of NIH every quarterly. Even every case evaluation was done in NIH OPD and IPD. Clinical improvements observed were confirmed by cross-query. Radiographic follow-up was done in a long gap as repeated exposure to X-ray is harmful. Our patients were intellectually not so sound to cooperate research study. Infrastructure of research in NIH is very poor because it is an academic institution basically. And we are having some research institution other than this academic NIH. That's why emphasis was given less. But is your expectation and desire, heartier desire that NIH authority, governing body, administration, they must think twice that the aggregation of best possible brains is in NIH. Aggregation of best possible patient, huge number of patients is in NIH. Competency, departments, faculty, doctors are best in NIH. In all over the world, I am telling, not only in India. So these these huge sources can be definitely excellently utilized in research projects that will help homeopathy to progress very fast. Now, result of homeopathic treatment of degenerative joint disease. This is very important. See the chart, master chart, radiological cure of diseases. The points are noted, serial number, research registration number, OPD registration number, name, age, sex, religion of the patient, time taken for radiological cure. You will see from the day treatment started up to the day treatment was completed by documentations, total months taken for complete cure of the radiological study was given under this table, time taken for radiological cure. Next is radiological diagnosis. It was done by radiologist. You will see the documents. Every report was signed properly by the competent radiologist. The drug. We will observe the drugs. Which were the drugs we gave complete cure of the patient. Number of documents. How many documents have been presented to support the cure of the patient. Number of visits in OPD. How many times patient has visited in OPD? Cost of the treatment. As per rupees at that table, probably rupees 5 was per visit. Accordingly, the cost was given last to present that how much cost-effective treatment homeopathy is for the patient. First case, I will not go through details of the every point. Just as per example, first case, research registration number 02, OPD registration number such and such, name, age, S. Natua, 43, female Hindu, from 1/10/10 to 14/3/12. Just see the period. Total months 15. Radiological document, sharpened articular facet was diagnosed by radiologist. Drug was Narayan. Number of documents 6. Number of visits OPD 8. Cost of the treatment is rupees 40. Second patient, we will show here. Research number 30. OPD number 3803. A. Boiragi, 29, female age. You just observe the ages, sex, religion. You will find that it is unconditional. Any age, any your gender, any caste and creed may be victim of this degenerative joint disease. Treatment started from 3/12 age, completed in 3/3/10 by reports. Total months taken 15. Radiological diagnosis was the same, sharpened articular facet. A brief I want to tell you what is sharpened articular facet means the spinal vertebral column. The vertebral body has taken sharpened by degenerative changes, leading to various types of compression in the nerves, irritating of the adjacent ligaments tissue, leading to severe pain. The medicine was given Netramune. Number of documents 6. Number of visits was 17. Cost was rupees 85. Third patient, 41, research number OPD. A wrong, 35, female age, 29/9/10. Treatment started. 15/6/11. Treatment completed by reports. One more thing I want to tell you that all the patients were radiologically found cured. All the patients were strictly asked to come after 6 months to show us that whether this disease has relapsed or not. We have not seen a single case after radiological cure by the constitutional drug, patient reported with relapse or complaint or degenerative joint disease in that joint or any other joint of the body. That's what I want to tell you. Homeopathy not only cures but also prevents other joints from degenerative joint disease by improving all physiological necessities, by improvement of metabolism, hormonal system, everything, to maintain normal structure of the bones and joints. Next patient, I don't want to put the name, etc. Just focus on the drug. Total months taken 9. Within 9 months, 5 o'clock was the drug. Cost was 25. Number 4, total months were 18, taken for cure. Drug was net term solved. Number of documents 6. Number of visits were 10. Cost was 50. Next, case number 5. Total months taken 13. Nactamur was the drug. 9 documents, 6 documents, 10 visits, 50 rupees. Number case 5. Total months 13. Same diagnosis, serpent articular facies. I just told you, Nactamur. Next, number 6. Total months taken 11. Drug was hypericum. Hypericum was a peculiar drug. I just want to tell you, that is my experience. You can try yourself. That whenever I find that pathology is less, but complaints, symptoms are very serious. In this case, I found that certain articular facies is definitely there. Patient is definitely supposed to complain from pain. But pain was so much that the patient were carried by the associate peoples to the OPD for treatment. He was not able to stand, as if there was severe collapse or severe subluxation of the spinal cord by severe compression. When I asked the patient to test the root or girdle pains, it was negative. But subjective complaints are very, very much serious. I concluded, you can also try of your own, that hypersensitivity of the nerves is an uncommon picture of these cases, because I didn't find any other homeopathic mental or physical general symptom as specific or individualistic. Let's say that pathological complaints, minimum pathology, maximum complaints, means hypersensitivity was very much uncommon, specific, special symptom for the patient. That was given emphasis, and I got brilliant result, means to the extent of complete cure of the radiological changes. Next drug is 18. Drug was Mediterranean. Only 6 documents, only 5 visits. So just imagine number of visits. The case was completely cured. Next is Nactamur. Cost was 15. Time taken was very minimum, as you see in the chart. Next drug was Fuja. 6 reports, 5 visits. Next patient was by radium bromide. 6 reports, only 4 visits. Just imagine, by 3 visits, by 4 visits, as you see in the case number 8, by 3 visits only, patient is getting radiological cure. Can anybody, any system of medicine can imagine that by 3 visits, within a period of from 8-10, just see the dates, 25-8-10 to 2-11-11. Within a year, patient only came thrice. There also patient got completely radiological cure. The next drug was Thuja, 5 visits. Next is radium bromide, only 4 visits. Just imagine what is homeopathy. Next, case number 12 was Bryony alba, 11 visits. Then case number 13 was Lycopodium, 11. Case number 14 is Bryonia. Case number 15, Lycopodium. Case number 16, Gelsemium. See, Gelsemium is called to be a drug of nerves, temperature, etc. But Gelsemium can be a drug for cure of degenerative joint disease. Can anybody easily imagine? This is homeopathy, brothers and sisters. Starting from Acute to Ginkgo, our teacher is to tell that starting from aconite to gingham, any drug can cure any disease. This is the mystery, beauty of homeopathy. The next, case number 17, osteophyte. The case 16 case was very interesting. Listiasis, last three was osteophytes. Number 16 case was listiasis, means a serious disease of spinal cord. When the vertebral column has become dislodged from its original place, dragging the spinal cord, giving tremendous pain, that case was simply given by Gelsemium by seeing his exaggerated excessive nervousness, loss of thirst, and undue tremor. Patient neither had thyroid disease nor any other diseases which represent tremor, but patient was unduly trembling due to fear. He will die. He will not survive. So this exaggerated nervousness, tremor, and thirstlessness insisted to give Gelsemium, and that Gelsemium started improving with a very short time and ultimately cured by 12 visits. Case number 17 was osteophytes, bone growth. Rastras was the drug. Case number 18 was osteophytic changes. Calcarea fluor was the drug. Case number 19 was fluoric acid. Here I want to tell you one thing. Whenever you find any patient who is feeling fresh by exertion, that means more he exerts, more the patient exercise, more the patient is under physical strain, patient feels better. Reversely, when patient is under rest, when patient is having less work, complaints, pains aggravate. That means vigorous strength physically, mentally is an indication of fluoric, as we all know, that can also cure degenerative joint disease. Number 20 cases was osteophytes. Salicylic was the drug. 6 visit, 6 reports, 14 visit. Now there is one thing latent from 21 to 29 radiological cures of 9 cases of osteophytes has been already presented in this third CME of this session, third phase. All of you have observed these 55 documents. Now why I am presenting this chart, master chart? I want to emphasize repeatedly that this master chart confirms that individualistic approach can cure any type of pathological disease to its curable range. We are not claiming that all pathological changes can be cured by homeopathy, but many so-called incurable, so-called not reversible, so-called not improvable cases can be cured and improved, and radiologically can be cured by homeopathy system medicine by any and every drug. Nobody knows which drug will, which will be the uncommon symptoms, which will be the drug of the patient. That we should always keep in mind. Obviously, as Dr. Sharma shows, to tackle the cases, it was given by the Hahnemann himself. We have to tackle the case according to its necessity. Obviously, palliation is necessary. Master Hahnemann has told you should give Syncona in between the fever stages of malaria. It is necessary. We have seen there are nectar salve, there are calcarea fluor, means combination of drugs, combination of chemical substances. It is true. But all the drugs will give palliation, improvement definitely. Incidentally, accidentally may give documentary cures. But if we proceed through this usual system or Hahnemannian system, that means evaluation, enumeration, repertoration, and prescription, you will see number of cases, incurable so-called cases can be completely cured by homeopathy. Even if they are astonished by your improvement, your
স্যার আপনার এটা হয়ে গেছে স্যার। কল্যাণী স্যারকে একটু ফোন করে দিন। কল্যাণী স্যারকে একটু ফোন করে দিন, ওনার ফোনটা হয়ে গেছে। ডক্টর বিদ্যুৎ মুখার্জি, প্লিজ একটু কল্যাণী স্যারকে ফোন করে বলে দিন যে ওনার ফোনটা কেটে গেছে আর ওনার অডিও মিউট আছে। ওনার ল্যাপটপ পুরোপুরি 0 ভলিউম আছে, তো উনি শুনতে পাবেন না আমাদের কথা। প্লিজ, ইটস এ রিকোয়েস্ট, প্লিজ একটু বলে দিন। দ্য অডিও হ্যাজ বিন মিউটেড, প্লিজ একটু বলে দিন স্যার। স্যার, স্যার, হ্যালো।
গুড ইভিনিং স্যার। কোথাও মিউট হয়ে গেছে।
স্যার, উনি শুনতে পাচ্ছেন না, উনি শুনতে পাচ্ছেন না। He can't hear you. Please call. Please call. Hello. Please call.
Okay. I'm calling.
Please hold on. We are trying to reach sir. হ্যাঁ স্যার, আপনার কেটে গেছিল স্যার।
হ্যাঁ, আমি ওটা খেয়াল করে নিব। ঠিক আছে, সরি।
ইটস ওকে স্যার।
নেক্সট, normal study. Case number 7, before treatment. Case number 7 was a case of still serpent articular facet. Medicine was given Narayan. Homeopathic system of medicine. After treatment, it was done from outside, normal. Next, case number 8. The case was of serpent articular facet. Drug was nature new. These are the changes certified by the radiologist after treatment. It was also done from outside as per desire of the patient. Case number 9. It was the case of serpent articular facet. Medicine was given Sorana. Usually called to be a drug of skin disease. after treatment, normal study. See, at a time, both cervical and lumbar became normal. Let me show you again. Lumbar and cervical both having the changes, radiological patient. We have seen, and we have we didn't discourage any report from inside or outside. Reports. Case number 11, before treatment. This was also done from outside. After treatment, it was done from another laboratory. So not that this documentation is preconceived or planned from anywhere, from inside or outside. Patients are getting radiological investigation and showing us the reports, and we are finding that things are changing. Case number 12. This was also from outside. এবার ঠিক আছে তাই তো? That was my fault. I kept my mobile nearest to the laptop. Anyway,
স্যার আপনি ল্যাপটপেরটা আপনি না 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 ছাড়ুন স্যার, কোনো অসুবিধা নেই, কোনো অসুবিধা নেই।
is it okay?
ইয়েস স্যার, স্যার আপনি ল্যাপটপের মাইক্রোফোন না ঠিক আছে স্যার, আপনি করুন করুন স্যার, ইট ইজ ওকে স্যার, আমি হোয়াটসঅ্যাপে লিখে দেবো স্যার যদি সমস্যা হয় আবার। স্যার কন্টিনিউ করুন স্যার।
This is after treatment. Normal study. Case number 15. Before treatment. Is it all right, Prof?
Yes sir, it's all right sir.
Osteitis. Case number 15. Is there any problem, Orko?
No sir, there is no problem sir.
It has become freezed, I think. Is it all right?
It was all right sir, now your phone just cut off, I means your laptop just shut down, I guess so. It was all right from the
What is
beginning.
to be done? What is to be done?
It will be best if you sir rejoin with your laptop again. It's just leave the phone and just rejoin with your laptop again.
It will be a problem for me, I think. If I fail to join, then
You will be not sir.
okay,
So
okay.
you just
Please help me. Yeah?
yes sir, I am there with you sir.
I'm just going back.
Yes sir, just go through with the laptop.
Uh,
Then click on that
then
how you have entered via laptop, just re-enter over there.
should I click on cross? I should go out of the pictures.
No sir, just minimize sir, just minimize.
Oh, just minimize. Okay.
Oh
I just
sorry sir,
minimize.
sorry sir. Sir,
Then
before that sir. Sir, can you see the StreamYard link on the right side of the left side of that
Premier link.
StreamYard?
Should I join?
StreamYard.com, something like that, a tab.
Left side of the laptop.
In that same page where you
Okay,
have
let me
opened
join
your
again.
PPT.
By WhatsApp, I have to come.
Via WhatsApp again, sir. Yes, sir.
Premier.com. Below the
Yes, sir.
below the laptop. Below
No,
the
sir.
laptop,
Sir,
Premier.com.
rejoin via WhatsApp
Then
again, sir. Rejoin with the
okay,
same
I am
link.
just rejoined.
Yes, sir.
Okay,
Yes,
okay.
sir.
Hmm. Okay. There is a problem. I am not able to do it. CME,
Yes, sir.
then how to bring the item below.
Sir.
What's another?
So just take time, sir.
Hmm?
Just take
Click
time.
on.
Click on
Okay,
the
let me call my
premium.com link which we have sent it to you, sir.
premium.com link টাকে নিচে নামাতে পারছি, এর প্রবলেম হচ্ছে। I am not able to bring it down. How to do it?
Maybe, sir, you can just turn the camera on. Means turn the camera.
Camera on means my
Click on
camera
click
by
again
other
with that streamer. Sir.
Premiere I am clicking, but the joining is not coming.
Sir,
See,
it
let
will
me
take time, sir. Just hold on a minute.
so let me call my brother.
Hmm.
কি করা যাবে? What to do?
স্যার এখনো যেরকম সমস্যা হচ্ছে আই গেস যে প্রবলেমটা যেটা হচ্ছে এখানে কি সমস্যাটা হচ্ছে আমি এক্সাক্ট এখন ধরে উঠতে পারছি না।
Sir, good evening, sir.
বলো। Good evening, বলো।
Technical snack যখন হচ্ছে, we will have this on another section, the rest part.
সেটা ভালো হয় তাহলে।
হ্যাঁ, কারণ আজকে
দেখিতে হয়ে গেছে
মানে অনেক কটা টেকনিক্যাল স্ন্যাক is going on.
টাইমটা অনেক
to all our respected viewers,
পরের দিন হবে।
to all our respected viewers who are watching it live now and will be watching later on, we are facing a lot of technical snag tonight, as most of the times, I presume. But however, there are a few questions from Probir Majumdar, Dr. Probir Majumdar, I presume, as usual. Dr. Pralay Sharma is there. I'll request Orko to highlight the questions. If Dr. Pralay can answer, or will plan to answer later on. Dr. Ramkrishna, you are there?
Yeah.
Sorry, very sorry.
Okay, as Dr. Pralay Sharma is also facing a lot of connectivity issue, I'll just get the questions on screen. Just hold on. Questions are there on screen, but
that will be best to discuss.
I will request, I'll ask Dr. Pralay Sharma, I'll request Dr. Pralay Sharma to answer it in a later stage. from the what to say from the not from the live chat but on the later chats. The first question was
Hello.
emaciation, cachexia of malignant cases after chemotherapy, radiation, vomiting, weight loss cases. Why only hydroxyl scan important? Because as like other medicines like alpha sol, radium, X-ray used. Uh, if Dr. Ramkrishna or Dr. Kalyani can answer, but I spoke to Pralay over phone. Dr. Pralay will be, he is now in some other important assignment, being the hospital in charge. So the answers will be provided in the later stage. And Dr. Ramkrishna, if you want to answer, you can answer this.
No, no, actually, the medicines names are here. It's not exclusively these medicines will be used according to the symptom similarity, because we know that homeopathy does not depend on the name of disease, never treat the disease name on the basis of name of the disease. So not that these few medicines like alpha, radium bromide or X will be used, but mostly we, from the standpoint of therapeutics, we generally use these medicines, but not necessarily mean these medicines would only be exclusively used. I think so.
Uh, there is a second question from Dr. Majumdar. Esophageal cancer, only alumina, cadmium sulf helpful, but some medicine like Orenthigellum, geranium mac, methotrexate, euphorbium useful with successful results.
And the same thing is here also. Same thing is applicable here also, because
Okay.
we never treat the any kind of disease in the name of the disease. Pathological changes or name of the disease, on the basis of that we sometimes prescribe the medicine which is known as pathological prescription. But where the symptoms are very prominent of a particular drug is indicated, definitely we should not give that kind of medicine which is uh, prescribed on pathological basis. First of all, we have to know this, because you are all senior, that you know that particular any kind of medicine is not used for a particular disease. Homeopathy never believes, homeopathy always believes its symptoms and the symptom of the patient first, not the disease. We used to say that homeopathy treat the disease but not ignoring the patient. Sorry, homeopathy treat the patient but not ignoring the disease. So definitely we should consider the disease symptom, but always our first priority is always the symptoms of the patient. So where the symptoms of the patients are very much prominent, we must prescribe on that basis. But where these cases what we discussed, especially Dr. Kalyani sir, and the conditions where the extreme pathological changes has takes place, in that cases, most of the cases we used to prescribe on pathological basis. That's why these questions come, that whether should we prescribe this kind of medicine on therapeutic basis or not. Otherwise, we always try to prescribe on the basis of symptom similarity, and especially on the characteristic symptom of the patient. Again, I am telling you, patient.
Thank you, Dr. Ramkrishna. We are not taking up the other two questions. It has been forwarded to Dr. Pralay. And Orko, if Dr. Kalyani sir is there, sir, there were some technical snags. We're sorry we couldn't complete it. So I'll request you,
No,
sir, to
I'm also
conclude.
very sorry.
Okay. Thank you. We'll try in the next session, sir.
No problem. No problem.
Answer. Okay.
And
Anyway, simply this will encourage
we
us
like to thank
to document.
Dr. Ramkrishna to be present on the session tonight, and he being the inaugurator also took up the task of the moderator too. Thank you, Ramkrishna, from our heart, and we want to see
Many thanks.
you in the
Thank
coming
you,
days
Bidyut,
as
and
a
thanks to
speaker.
our Dr. Kalyani sir also, and Orko also, everybody. and those who are watching across the globe.
The more you will come forward, definitely. The more you will come forward, more you will be encouraged.
Sir, you are enough
Right,
to
sir.
encourage everybody. Your presence is enough
No,
to
no.
encourage everybody.
My
Uh,
existence by you only.
Just to seeing your
Anyway,
face, everybody will be
Thank you,
encouraged
sir.
that capacity you have. That we can claim.
Uh, Thanks all of you. And with this, we will be having our 75th CME in the month of July. That is on 8th of first, second. On 9th of July, we'll be having our 75th CME. We are trying to plan, we are planning out some exclusive sessions for the 75th CME, and we need all of your cooperation. The viewers, please stay tuned with our channel, and across the globe, all the alumni, please come forward with your suggestions how we can develop and what are the topics can be discussed, who we want as a speaker. And with that, we are returning with permission from Kalyani sir. We are returning back to the backstage editor, Orko.
definitely. 75th will be a brilliant presentation from us. We must think accordingly.
Definitely, sir. Okay, sir. All the best and good night to everybody who are watching this program across the globe. Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have any doubts regarding today's CME, you can ask on the comment section below. Just comment it doubts, and the answer will be provided to you over there. Or you can join us on our Telegram channel. The link is in the description. There we have a common discussion group which you can join via through it, and there you can just ask your question, your doubts regarding today's topic, and we have our speakers over there to answer. So with this, thank you all for watching. Have a nice good night. See you on our next CME. Until then, bye.